In the fifth and final section of the lecture, now we will talk about the diseases of the lingual tonsils. And the diseases which we will discuss in this section will be acute lingual tonsillitis, hypertrophy of lingual tonsils, and also the abscess of lingual tonsils. The diseases of the lingual tonsils are the tonsils here on the tongue. Lingua is the tongue. So two types of tonsils are common: palatine tonsils, which we already discussed in the oropharynx, in the lateral part of the oropharynx, and these are the lingual tonsils now. Lingual. This is the tongue, and that's the location of the lingual tonsils. And this on top is palatine tonsil, and then we have pharyngeal tonsils are there. So this is the lingual tonsils. Acute lingual tonsillitis, then we have hypertrophy of lingual tonsils, abscess of lingual tonsils. So these are some diseases of lingual tonsils. Acute lingual tonsillitis, because it's now in the tongue, so the tongue is mostly affected and becomes painful in lingual tonsillitis. Unilateral dysphagia, the difficulty in swallowing on one side is present, so is unilateral dysphagia, which is difficulty in swallowing. Feeling of lump in throat. Lingual tonsils become enlarged and congested, and they are studded with the follicles. Same as we saw in the palatine tonsils, here also they are studded with follicles and they become enlarged and congested. Cervical lymph nodes are also enlarged along with the acute lingual tonsillitis. Treatment is antibiotics. Next, hypertrophy of lingual tonsils. If they become hypertrophied, you can see there is hypertrophy, that's the back of the tongue, and the lingual tonsils become enlarged and hypertrophied. Compensatory hypertrophy of lymphoid tissue, that's one cause of hypertrophy. Enlargement of lingual tonsils, there are dilated veins. Patient complains of difficulty in swallowing, feeling of lump in throat, dry cough, and thick voice. All these are the complications that patient will present, or the symptoms that patient will tell the doctor. They have difficulty in swallowing, they feel a lump in the throat, there is thick voice and dry cough, and this hypertrophy of the lingual tonsil is mainly as a compensatory mechanism. Whenever there is infection going on, they hypertrophy to fight that infection, and that hypertrophy leads to hypertrophy type of lingual tonsillitis. Treatment is conservative diathermy, coagulation, excision because they are hypertrophied, and laser surgery is the treatment. Next, abscess of lingual tonsil, a rare condition but can follow acute lingual tonsillitis. So after the lingual tonsillitis, there is formation of abscess that leads to abscess of lingual tonsil. Symptoms are unilateral dysphagia, pain in tongue, excessive salivation, dripping from the mouth, drooling from the mouth, excessive salivation, and then there is degree of trismus or the lockjaw because of the pain in this whole area. Jugulodigastric node enlargement and tenderness, and there is also laryngeal edema that affects the speech or sound also. So these are the symptoms of the patient with the abscess in the lingual tonsil. Diagnosis and treatment is by mirror examination, palpation of base of the tongue where the lingual tonsils are present. By palpating that base of the tongue, we can diagnose the lingual tonsillitis. Treatment: antibiotics, analgesics for pain. Proper hydration is very important, and incision and drainage of the lingual abscess is important to relieve the condition. Once the incision is done and abscess is removed, then put the patient on antibiotics that will help to improve the condition. So incision and drainage of the abscess is very, very effective. That was all about our lecture, acute and chronic tonsillitis, in which we discussed in detail both the acute and chronic tonsillitis, how the patient with these two conditions present, and what are the complications of acute and chronic tonsillitis if not properly treated, not properly managed, can lead to serious conditions like endocarditis, glomerulonephritis, rheumatic fever, and also we discussed in detail what are the differential diagnosis of acute and chronic tonsillitis and how we can differentiate. So that was all about our today's lecture. Thank you for watching sqadia.com.